Yes, good morning. In my research, I've come across numerous studies done on this, undertaken during the pandemic when it comes to, there seems to be no disputes that there is a high rate of hesitancy among African Americans when it comes to getting the COVID-19 vaccine. But as with most things medical, it's ultimately a personal decision. But some say getting the vaccine is for the greater good.
There's no pain worse than not being able to see your members.
Reverend Charles Williams II of Detroit's historic King Solomon Missionary Baptist Church says that's one reason he got the COVID-19 vaccine, so he can get back to visiting the sick and the homebound. Williams acknowledges his willingness to get vaccinated puts him in the minority within the black community. In fact, a study through the University of Michigan found 67% of black residents surveyed in Detroit opposed getting the vaccine, compared to 31% of white residents in opposition. For blacks, the distrust is believed to be rooted in part in a painful past.
There's the Tuskegee experiment, but then there's the personal experiences of everyday individuals.
There have been studies that have been done intentionally to withhold treatment from Black and brown people. And still to this day, there exists bias in the healthcare system. So there's a reason why many people in Black and brown communities may be hesitant about the vaccine. But I do think that we are making progress and that there are things we can do about that.
Dr. Jonae Khaldun, the state's chief medical executive, says town halls and forums are taking place.
I think first and foremost, it's important not to shame people and to meet people where they are. It is actually okay for people to have questions about their health care, to have questions about vaccines.
Dr. Sam Masalam, who spearheads outreach initiatives for Henry Ford Health System, says even some of the staff is skeptical.
Especially employees of color. We are seeing it in our communities. To date, had over 120 webinars and educational activities and seminars, really focusing on education, trying to dispel theories and myths, and trying to really share with our communities that they are part of the solution to this pandemic. And without them, we wouldn't succeed.
All agree on reaching people through trusted spaces in their communities, like churches. King Solomon is a step ahead, already serving as a COVID-19 testing site.
Now, Dr. Khaldun says the state has set a goal to vaccinate 70% of Michiganders ages 16 and up as soon as possible. Access is another issue. Reporting live this morning, DARREN Cunningham, 7 Action News.
You know, and I really liked how Dr. Jonae Khaldun was saying, DARREN, you know, it's okay to have questions and to meet people where they are and answer those questions. A lot of people have questions about this. I mean, it's been more than 100 years since we've gone through a process like this. But yeah, getting people the information they need is so important, and also getting those vaccines out to the most vulnerable in our communities.